So once we have the results from this testing, what can we do and extrapolate from that in terms of helping to set out a treatment plan?
Well, in some cases, it's pretty straightforward. If you've got somebody that's got some classic symptoms that they've got too much estrogen, and you do a test by whatever method you choose, and the estrogen levels are high, then that confirms your suspicion. But what if their estrogen's normal, right? Then it introduces the concept that, well, some other hormone that's balancing that, in this case progesterone, you can have normal estrogen, but your progesterone's too low. So it's important to measure more than just one hormone, and sometimes you got to look at the balance and see it's the balance, not the absolute level of estrogen's high, or this fellow doesn't have enough testosterone, for example. So things like that. It can be an overt excess or deficiency, but sometimes it's more tricky, and that's where you have to do your homework. It's like, okay, it's the balance, or the genes are amazing. They weigh all this information like analog computers.
This discussion is fantastic because really the mandate of this series is to try to help inspire and educate women so they can make some wise choices about their own health and the path that they want to take for their own well-being.
And no woman, man, woman, child, whatever, no one should be afraid to go to their doctor and be talked down to, or feel like they can't bring these things up. And a truly humble physician is gonna if they don't know maybe some of the things that their patient knows, they shouldn't dismiss that, or they should say, okay, well, here's an opportunity for me to be educated, which is the way a lot of us got into this is we just got curious, and our patients taught us how to heal. And so a good doc should welcome that from their patients. So if this helps to educate some women to get out, and the system's never going to change unless the consumers go in there and say, I'm not satisfied with this answer that I'm getting old. You just have to put up with it. So it's never going to change unless empowered people go in there and say, I'm not settling for this. There's something more. I know. So help me